Hello guys, welcome back to the Health and Wellness Connection TV show. I'm your host, Dr. Barry, and I'm here to, try to live up to the commitment of bringing you the best health and wellness information available on the interwebs. Now, of course, we have a huge staff here at AfroVibes Television that helps make this thing happen. I want to give a shout out to everybody involved, as well as AfroVibes TV studios located here in Houston, Texas, where it is very hot, in case you're in the area. However, we're still going to keep pushing because we think it's very important. Now, of course, you all know we took a brief hiatus here the past few weeks just for a mental health break. Now, of course, that will come up because that's actually been in the news, as I'm sure you guys are well aware, and has really affected the Olympics actually quite a bit, which we'll also discuss as well. So stay tuned for that. But yes, I just want to thank you guys for tuning in, and thanks for your support. Don't forget, guys, if you want to support us, because we also, are looking at, expenses that we're trying to tackle, but want to make sure we let you guys know if you're looking to support the movement, don't hesitate to reach out to AfroVibes Television, be a sponsor, advertise your show. You can feature your business, on this show, which is seen by millions, and I think ultimately, it could be a great way to help yourself as well as help the station. So consider that, guys. So that being said, let's get right into it. I'm sure you guys know, COVID-19 has really been in the news. This has been the summertime. A lot of various nations across the globe have been relaxing their various travel restrictions. They're trying to get the economies of various countries back in gear, and as a result, it has led to a lot of issues as far as figuring out the best way to manage this COVID-19 virus. Because as we all know, as people get together, there's an increased chance of transmission. And the vaccines that have also been on the market now are really being put to the test. And we're starting to see what vaccines are working and which ones aren't. And it's really kind of letting everyone know how we're going to be moving forward, because this COVID-19 unfortunately is not going away. And as a result, many things are going to be changing as far as their everyday lives. Now, that being said, let's briefly go over the numbers so we can see kind of how we're doing. Overall, COVID-19 is a huge thing, and there's over nearly 200 million people affected by the virus completely throughout this entire pandemic. About 4 million deaths total. So the numbers are still climbing despite the vaccine penetration. We're going to talk about those deaths and how they kind of start to separate themselves, and gives us more information as far as what's working and what isn't. And despite, though, the 200 million people who have died, there are 180 million have recovered. So just to make it clear that COVID-19 is not a death sentence, but it can definitely cause a lot of issues and really affect your life and your ability to function quite a bit. So I don't want to get people sometimes take it extreme, and which sometimes has a purpose in case they want to really enforce a message. And we're talking about how Biden actually was caught up in that situation where he said things that are a bit extreme, and sometimes he had to be kind of calmed down. But again, Biden has shown that he's very passionate about getting a handle on COVID-19, so his efforts are definitely applauded. So let's talk about it. So as we see, there are increases in new cases that are starting to trend upwards, and this is something that's being seen all over the globe. We have numbers slightly rising in various communities all throughout the United States. The United States is still the #1 nation total. So the United States is averaging about 53,000 cases per day now. Definitely upwards trending that we're seeing, and it's unfortunate because we were moving in a beautiful direction. We were sub 10,000 cases for many various weeks throughout the summer, but now we're starting to see those numbers starting to increase. Almost about 200 deaths per day we're also seeing in the various individuals. So it's definitely something that's being very closely monitored, because the hope is that with the vaccine penetration now in the United States at about 60%, that we should see significant improvements in those death rates. So even though there are significant numbers of people who are vaccinated getting reinfected, the good news is that those people aren't really getting those severe complications we were seeing in those who are unvaccinated, which we'll talk about in a second. Number 2 is India, with 41,000 new cases on average per day, about 500 deaths per day. So they're actually improving given where they were just a few months ago. They had significant high levels of death in the 3,000 or 4,000s per day. So we've got those numbers down. Thankfully, they are getting more vaccines on ground, and some people believe that is contributing to the improved numbers. But again, this is this kind of wave we're seeing it's still only August currently right now when we're filming this. So we expected those numbers to start to trend upwards, especially as the effects of people mingling start to establish themselves. However, it is still very early and the summer is still in full swing. So the fear is that if we're already seeing these trends upwards now, we could be in a very frightful situation come fall, like October, November, and so forth. So we're going to watch these closely, and it's still has influenced a lot of these new recommendations we're seeing from various health bodies like the CDC. We'll talk about those as well shortly. Brazil, number 3, about 37,000 cases per day. They've also had a very difficult time dealing with this pandemic. They've had significant surges and falls, but they've been trending upwards, unfortunately. However, the death rates, they're also seeing that small dip, and it's better than where they were, about 900 deaths per day, but still significant. So Brazil is definitely working hard and trying to improve their COVID management. And of course, their president, who has really been under fire for his lackluster approach toward the COVID-19 pandemic. Initially, the Brazilian president Jair Bolsonaro and has been the reason that many Brazilians are pushing for his ouster, just due to his callous approach toward the COVID-19, which many are blaming for the significant death rate they have been dealing with in the nation of Brazil. So Brazil's still definitely going through it. Number 4 is going to be Russia, which is also a nation that has had a decent response as well. They were one of the first to create a vaccine, which was actually considered to be fairly effective per Russian sources, about 90%. And they have actually still had a significant issue with new infections, but a little bit lower than some other nations we mentioned previously. About 23,000 new cases per day in the Russian nation, and about 800 deaths per day. So still significant numbers there, even though they are kind of low. Even though Russia never really had huge surges, at least nothing that was officially reported. But they definitely had their issues, and it seems like their virus management program has been actually fairly decent. So France is another nation, about 23,000 new infections per day, 43 deaths per day. So France has been fairly moderately vaccinated for an EU nation. They're about 60% have received at least one dose in the nation of France, and about 46% have been fully vaccinated. So the death rates are actually quite low there, and that would actually bode well for those nations that are being highly vaccinated, tend to having now much lower death rates than we're seeing. So just really emphasize the importance of this vaccine and why people are pushing for it to be kind of distributed as far and wide as possible. Now, before we talk more about the vaccine, let's talk about this Delta variant. The Delta variant has really been in the news lately. The Delta and all the related organizations like Delta Airlines or other fraternity sororities, are not really too happy, because the Delta has really been associated with a lot of death and kind of increased fear and increased kind of concern in the health community. So let's talk about the Delta variant and why it's a concerning variant. Now, the Delta variant is a virus that was actually let's talk about actually the naming nomenclature, because that's actually something important I want to make sure you guys understand. So you remember, guys, early in the pandemic when these new mutations would come out, because as we all know, the COVID-19 virus is highly mutagenic, meaning that it mutates very rapidly when it's inside an affected individual. So when this happens, new variants are established. This actually allows the virus to survive, when it's actually fighting for, per se, your immune system if you get infected. So the virus is adapting, moving, changing its form to be able to evade the immune system. As a result, these new mutations are created, which tend to be more contagious than their predecessors. So this is why it's been a huge concern to minimize the ability for these viruses to mutate. And there is some belief that those who are vaccinated may provide a less hospitable environment for the virus to hang out and mutate, right? So unfortunately, when these things are coming out now, before it would be the South African variant, the UK variant, there was even a Nigerian variant being discussed briefly, but that faded away. I don't know what happened to that one, but who knows? That being said, probably never denied it a visa, maybe, who knows? Either way, those variants have been kind of doing their thing, but this South African variant actually was the first variant that was determined to be fairly deadly, and there was initial concern when it didn't really respond well to some of the people who have been vaccinated with other vaccines like the Johnson & Johnson. They were still getting significant infections from the South African variant. Now, because of the various names being associated with different locations, and there was concern that would maybe affect them on a social scale, because people don't like really being associated with a deadly virus that's killing many people, right? So they're trying to change it to a Greek nomenclature. But because, of course, many people have used Greek nomenclatures for various purposes throughout history, there's still going to be people upset for that. So you can't really win in this situation. So unfortunately, if you're in a situation where your name is closely associated with a deadly virus like Corona, which was known as a pretty popular alcohol brand, but now it's kind of a different look there, as well as other organizations with names closely associated with the COVID-19. It's unfortunate, but that's the reality of the world we're in today. So that being said, this is now the Delta variant. Now this actually came from the nation of India when there was large outbreaks there about earlier in the spring. There was a belief that this mutation came out from that outbreak, and this mutation is very concerning because it's showing some signs of very kind of more aggressive behavior when compared to the predecessors, which is unfortunately what the current vaccines that are out there were built on. Now the Delta variants, the belief that this Delta variant is one of the most contagious and is actually responsible for most of the new infections we're seeing now in people who are diagnosed with COVID-19. The Delta variant is definitely being determined that it is affecting those who are unvaccinated far more severely than those who are vaccinated. It's believed that various studies that have been shown that almost of all the people who have gotten infected and who have been hospitalized, the vast majority, over 90%, have actually been determined to be unvaccinated, whereas those who have been vaccinated who get infected tend to have a mild symptom, mild symptom. They have basically mild symptoms throughout their disease course. So, sniffles, fevers, coughs, sore throats, but they tend to do just fine. So, and now let's talk about even that phenomenon, because when people who are fully vaccinated, meaning receive the full course of whatever vaccine regimen they took, you are believed to have received about 90 plus, let's say, percent immunity to the virus. Now, what we're finding is that people who are getting newly infected are getting infected with this new mutation, this Delta variant, because the Delta variant, apparently, you only receive about 39% protection against that variant, even if you've been immunized with what is considered the best vaccine protocol based on the percentages, that is the Pfizer vaccine. But even the other vaccines give great immunity protection as well. So if you've been vaccinated fully, you're still getting fairly low protection, meaning it's less than 40% protection against the Delta variant. So unfortunately, for those people who've been vaccinated and feel that they should be, immune, you're technically not, because you are potentially able to get an infection. And also, it seems that based on what we're seeing in the various studies that we're seeing regarding people who've been infected, we're actually seeing that these people who are also vaccinated and who get newly infected with this variant are now still able to spread it and still able to, basically give it to whoever's around them, because they're considered super spreaders due to the high levels of viruses we're seeing in their mucosal areas where the virus typically resides when it causes an infection. So yes, the people who are vaccinated are still capable of being super spreaders, meaning people who have mild symptoms who feel fine but still moving around spreading the virus to those, and potentially could really harm folks who are vulnerable. Now, this is something that we've seen in kids, because we've noticed that a lot of children tend to not have significant symptoms with the COVID-19 infection, and they also can become super spreaders. So technically, people who've been vaccinated now have the more ability to super spread because they're not as sick, so they actually can move around and feel good, yet they're still very infectious and can cause other people to get infected. So, it's something that is kind of causing some, initial, reassessment of how we're approaching this pandemic, because, we're seeing now that masks are something that could be, something that could be a very effective tool in helping reduce person-to-person transmission. As the thing with masks is that as you wear a mask, you actually reduce the amount of virus you are, expelling, and also you reduce the amount that is penetrating your system. Now, it's not a foolproof method, but it will reduce a significant portion of the areas where you tend to get infections when you are in the environment interacting with other people. So for this reason, many experts now are recommending everyone should wear masks, vaccinated or not, because if you do, it's going to help just reduce that transmission. If you're vaccinated, good for you in the sense that you will not, I will say not say you will not, because nothing is absolute, but the chance of you getting very sick, especially getting significant complications like pneumonias and heart problems, things like that, are reduced. Now, it's not eliminated, so if you see this one story on Facebook where someone got a vaccine and then died immediately afterwards, that's extremely rare, extremely uncommon, and is being pushed for a reason. Chances are something is going on behind the scenes that may benefit from that. So the reality is this, guys: we have over 1 billion people have been vaccinated now. There's an extremely low level of complications, less than 0.01% of people who have like severe complications requiring significant hospitalization. So I mean, at this point, the initial numbers are showing that the vaccine is actually quite safe. Now, of course, long term we don't know. So we know 30 years from now, some with a vaccine is found to be linked. That's something that's very difficult for people to predict until those time periods come. But in the short term, we have literally millions passing away. So it's important that we make sure that we do what we can to survive to that point, and then we can deal with that as it comes. But that being said, the Delta variant is still very serious, and it's, like I said, for this reason, this is why we're trying to reduce the amount of variants that come about. Now, as we just stated, the initial belief was that it's possible that the variants could be reduced if they are infecting people who have been vaccinated. That's something that has not been fully played out yet, and we don't actually know what's going to happen regarding the mutations going forward. But the belief is that this virus is probably going to be mutating, and there's a real chance that booster shots will be required every, who knows, 6 to 12 months is the initial prediction, but who knows. And this is part of the whole issue with many who have problems with the vaccination side of the whole thing. And it's definitely understandable, but we'll have to see how this thing plays out going forward. But definitely we're seeing now that the Delta variant is something to be concerned about, in the sense that you want to make sure you're doing everything you can to reduce your risk of infection, especially if you're unvaccinated, which hopefully, if you are not, there's a very strong reason why you believe that that's the way to go. So now the Olympics has been in the news recently, obviously, because it's going on right now. Tokyo, Japan. This is the current home of the Olympics, which were nearly canceled due to fears of COVID-19 being a dominant force in the Olympics, potentially creating a super spreader event. So Tokyo has been actually very strict in how they've approached the Olympics and ensured that they've tried to reduce increased mingling. They're trying to ban parties. There's no actual fans allowed in the stadium, so it's just a quiet stadium filled with paper cardboard cutouts of the stands. So it's really a COVID style Olympics, guys. So the good thing is that we do have great cameras and great technology now, so you can see really amazing quality footage in the comfort of your own home. So after this show is over on your Roku television, you can always look at some of the Olympic coverage as well, because it's quite entertaining. That being said, the vaccine has been a huge focal point as far as how the athletes are going to be protecting themselves against COVID-19. Now, apparently the COVID vaccine is not being required by the athletes, but athletes are definitely being required to mask up and maintain social distancing and just try to avoid getting in large groups.